Hi, Assalamualaikum. It's me again, Nur Adila Shaida, and today we are going to be talking about the common drugs in anesthesia. So first of all, we are going to talk about the induction anesthesia. The most common drug used to induce anesthesia is propofol. Propofol is a non-barbiturate agent which no one really knows how it works, but it will give you a very smooth and rapid induction. Propofol is commonly used with an opioid such as fentanyl. The major side effect of propofol is that it can reduce vascular tone, thereby reducing systemic vascular resistance and central venous pressure, and therefore affect cardiac output and blood pressure. Propofol also can cause respiratory depression and bradycardia. One thing to know in terms of patient comfort is propofol stings very much as it goes up the patient's arm. Another drug which can be used for the induction of anesthesia is thiopentone. This is the classic drug used in rapid sequence induction. And so, this drug is a short-acting barbiturate. Thiopentone can decrease intracranial pressure. The disadvantages of this drug is that it causes respiratory depression, bradycardia, and causing post-op nausea. Next is sevoflurane. Sevoflurane is an anesthetic vapor. This is commonly used in pediatric anesthesia. Well, maybe it's difficult to find a vein or to calm a crying child down to be able to cannulate them, so it is a lot easier just give them some sevoflurane gas to induce anesthesia. So now we are going to move on to muscle relaxants. They are depolarizing and non-depolarizing muscle relaxant. So the most common depolarizing muscle relaxant is succinylmetonium. Succinylmetonium is a very fast muscle relaxant within 30 seconds to work. The way that this drug works is it binds the postsynaptic receptor where the acetylcholine usually binds, and it causes depolarization of the cell. Much more commonly, the non-depolarizing muscle relaxants are used and competitively binds the acetylcholine receptor and block acetylcholine from binding there. So these are vacuronium, rocuronium, and atracurium. Clinically, all of them have the same effect. Just one thing to point out about atracurium is that it can be causing bronchospasms. So, we have to avoid with asthmatic patients. A good thing about atracurium, however, is that it's broken down largely in the blood. So, if the patient with liver or renal impairment, then it will probably be the drug of choice. So, to maintain an anesthesia, we can use gases such as sevoflurane, dextrose, and isoflurane, or we can set up a propofol infusion, or it's commonly called a TIVA. So talking about the gases, deciding which one to use can be quite controversial. Each one has its own advantages and disadvantages. For example, desflurane. It is quite an irritant to respiratory system, so we don't use it in chronic smoker or asthmatic. But on the opposite side, it increases recovery and the patient to recover from it quite quickly. Next is isoflurane. The advantage of isoflurane is that it's a very cheap drug to use. However, it does take quite a while to wake the patient up after they have been given medication. Okay, now is sevoflurane. Sevoflurane probably the best of the three, but the main problem of this is it is a very expensive drug. And that's it. Thanks for watching. Assalamualaikum and bye-bye.